Hello, welcome back. In this video, we are going to discuss something about dosage forms. Actually, what do you mean by a dosage form? Dosage form is a combination of drug and a non-drug. Drug is nothing but API, active pharmaceutical ingredient, and non-drug is nothing but additive or excipients. So, the dosage form is a combination of drug and a non-drug. So, combinedly, we'll see, first of all, we'll see what is the definition of a drug. A drug means what? It is an agent which is intended for using in the diagnosis, mitigation, treatment, cure, prevention of the disease, either in animal or in humans, right? An excipient is nothing but it is a bulking agent, either it may be diluent, either it may be filler. It is adding an additional advantage or additional benefit to the active pharmaceutical ingredient. Okay. So now coming to the definition of dosage form. A dosage form is defined as a physical form of a drug. For example, it may be solid or liquid or it may be gas, by which it is delivered into a proper form to a particular site of action within the body. That is nothing but a dosage form. Right. The characteristics of dosage forms. What an ideal dosage form should have? It should be easy and safe to administer. It is easy to reproduce and manufacture. A dosage form should be easy to handle. It should give a high patient compliance, and it should be readily available for all the patients. Means it should be economical, cheaply available to the patient care. And maintaining its therapeutic activity throughout the shelf life is also an ideal property of a dosage form. Next important thing, what is the need of a dosage form? Why we need to prepare a drug and excipient in the form of dosage form instead of taking it directly? The main advantage or main need of the preparing it into dosage form is to enhance the stability of the drugs. Normally we can't do it. So we have to, for enhancing the stability of the drugs at the normal storage conditions, we will prepare it into a dosage form. And the second thing is for easy transportation, distribution and production and effectiveness of the therapy, we need to prepare it into a dosage form. And next one, to provide a safe and convenient delivery of the accurate dosage, it is very much mandatory. And next, to provide for the optimum drug throughout the inhalation, it is important. And to provide a maximum drug action for the topical administration sites, for example, creams, ointments, ophthalmic preparations, everything, it is very much important. And to provide sustained release actions by controlling the drug release. For example, you can consider sustained release tablets, extended release tablets. For all these things, the dosage form is to be preparing it into a dosage form is very mandatory. Now let's discuss the classification of the dosage forms. Dosage forms are divided into various types based upon their physical state, route of administration, site of application, type of the vehicle, uses and sterility. But in this today's video, I wanted to discuss only about the physical state, how based upon the physical state, how the dosage forms are divided, and based upon the route of administration, how they are divided. First, we will see the physical state. Based upon the physical state, the dosage forms are classified into 4 types. Those are solid dosage forms, dosage form, semi-solid dosage form, and finally the last physical state of dosage form is gaseous. Now let's discuss the classification of solid dosage forms. Solid dosage forms are divided into two types, that is unit solid dosage form and bulk solid dosage form. The examples of unit solid dosage forms are tablets, pills, gadgets, capsules. Tablets means what comes under tablets? Lozenges, oral tablets, buccal tablets, sublingual tablets, chewable tablets, soluble tablets, hypodermic tablets. All these comes under examples of tablets. And coming to gadgets, gadgets are of two types, dry seal gadgets and wet seal gadgets. Coming to capsules, capsules are divided into two types, soft gelatin capsules and hard gelatin capsules. Now coming to bulk dosage forms, the bulk dosage forms are again divided into two types. Internal and external. The examples of internal bulk solid dosage forms are powders and fine powders, granules. Granules means effervescent and non-effervescent granules. Effervescent and non-effervescent granules. And the examples of external bulk solid dosage forms are, for this also, the example is powders, like ear powders, medicated dusting powders, medicated dusting powders are again divided into dusting powders. Dusting powders are again divided into medicated dusting powders and surgical dusting powders. And the other examples are snuffs, powders, means dentifrices. And here a controversy is like, few people now they are calling suppositories also. Actually, in the previous days, the suppositories people used to call, or in standard books, they used to give these suppositories in a semi-solid dosage forms. But now this is coming into the classification of solid dosage forms. Because the definition of solid suppositories is, suppository is a solid dosage form where we will use semi-solid bases. So suppositories, mostly it will fall in the category of solid unit dosage forms. And the types of suppositories are, there are 5 different types of suppositories: rectal suppository, vaginal suppository, urethral suppository, nasal suppository, and ear cones. The next classification is liquid dosage forms. The liquid dosage forms are classified into two types. Monophasic liquid dosage forms and biphasic liquid dosage forms. The examples of biphasic liquid dosage forms are emulsions and suspensions. The monophasic liquid dosage forms are again categorized into two types. That is, internal monophasic liquid dosage forms and external monophasic liquid dosage forms. The internal monophasic liquid dosage forms examples of monophasic liquid dosage forms that are taken internally are syrups, elixirs, solutions, and linctures. And the external basic liquid dosage forms. That is again categorized into three types. External monophasic liquid dosage forms that are applied onto the skin. Those are used in the oral cavity and those are installed into the body cavities. The examples of the external monophasic liquid dosage forms that are applied onto the skin are lotions and liniments. And the external monophasic liquid dosage forms that are used in the oral cavities are gargles, mouthwashes, and throat paints. And the examples of the dosage forms that are installed into the body cavities are eye drops, ear drops, nasal drops, and so on. Solid dosage forms. These semi-solid dosage forms, they serve as a carrier for the drugs that are topically delivered by route of skin, rectal tissues, mucosa, vaginal, and buccal tissues. These semi-solid dosage forms, these are generally presented in the form of creams, gels, ointments, pastes, jellies, etc. The next classification is gaseous dosage forms. These are in the form of gaseous, and the examples of this is aerosols, sprays, and inhalations. This is what about the classification based upon the physical state. Classification of dosage forms based upon route of administration. First route of administration is, here we can write route, serial number, route, example. First one is first route of administration, the king of routes, and mostly 90% of the dosage forms will take by this route, that is like oral route. So the examples of the dosage forms which are taken by oral route are powders, tablets, capsules, solutions, emulsions, syrups, elixirs, magnum, catchets, pills, gels, all comes under this route. Second one is parenteral route. Examples of parenteral route are solutions, suspensions, emulsions, tablets, implants. Topical route. Examples of topical route are ointments, creams, powders, pastes, lotions, plasters, liniments, gels, transdermal patches, all comes under this route. Next route of administration are urethral. Examples are suppositories, pouches, pessaries, vaginal, rings, tablets, all comes under this route. The next route of administration is rectal. Examples are suppositories and enemas. Next route of administration is sublingual. Examples of this is lozenges and tablets. The next one is intranasal. Examples of this is solutions, sprays, and inhalers. Conjunctival. Examples are ointments. Next one is ophthalmics. Examples are eye drops, ophthalmic gels, ophthalmic ointments, solutions, etc. Next route of administration is intra-respiratory. Aerosols. Optic, ear drops. These are various classification based upon the route of administration. Yes, in this video we have seen the various classification of dosage forms based upon physical state and route of administrations. Thank you.